Euan Stainbank.
Thank you, Madam Deputy Speaker. And I want to thank my honourable friend for bringing forward this rare cancers bill. It may be the most repeated phrase in this chamber, but politics is about choices. The member for Edinburgh South West, having ranked so highly in the private member's bill ballot, an early accolade in this Parliament, chose to bring forward a bill that will put patients suffering from a rare cancer and their families higher upon the list of priorities. As was so movingly put by my honourable friend for Calder Valley, what I hope this will mean in time to my constituents in Falkirk and for families across the United Kingdom is that in some instances we will get precious hours, days, weeks and years extra to spend with our loved ones. Every member of this House and every constituent I've spoken to about this has a story of a loved one who has suffered through the heartbreaking cruelty of a cancer diagnosis. I lost two of my grandparents in their early 60s. I still remember the 7 years of my life I had to spend with my granddad Robin. We still found plenty of time to exchange robust views on football, and I'm sure if he had more time with us, we'd be exchanging our views on life and politics today as well. He was lucky, though, to meet all four of his grandchildren thanks to the immense care he received from his doctors and support from his family. I remember my granny Janet, who passed away in 2012 after a 10-month battle with a brain tumour. I remember most fondly her fussing over everyone in the house to make sure they had absolutely everything they needed at all times. And I remember holding her hand in the Strathcarron Hospice, where she had volunteered for a number of years and then subsequently received care from in her final days. One thing I've drawn from these experiences is the value our NHS and hospice staff have for both those who have cancer, but also for their families. They're the ones who take the worst parts of life day in, day out, and allow us to endure, and are the people we should be arming with the best possible tools to treat illness and disease. While statistically half of us in this chamber may have, or one day will have to comprehend our own diagnosis from some type of cancer, the definition of rare cancer for the purposes of this bill, one that affects 1 in 2,000 people, is something we must acknowledge as requiring active intervention in order to put research, treatment and clinical pathways on the same parity as the evolution of other cancer research. As has been mentioned, when we talk about rare cancers, we're talking about 47% of all cancer diagnoses. I'll go through the bill in each of its specific clauses to show why I'm supporting it. Clause 1 in the statutory requirement for a review into orphan medicines will be an essential step to comprehensively understand the current availability of medicines, as well as how they can be best calibrated towards new treatments and new research. The comparative approach the bill puts forward for this review acknowledges that while we have a proud history of world-class research, other countries have been able to make substantial strides in this area, while we have not in recent years. In the last 6 years, the UK has dropped from being ranked second for the availability of orphan medicines, only behind Germany, to 10th in England and 13th in Scotland today, when compared to other European countries. To me, that does not necessarily look like regression, but potentially exposes stagnation in advancing research to the benefit of those suffering from a rare cancer. The British pharmaceutical industry have stated that it is increasingly challenging to develop medicine for rare diseases in this country, citing, amongst other things, the low prospect of NHS reimbursement for rare disease medicines. Clause 2 adds the specific duties on the Secretary of State to promote research into rare cancers, ensure patients can be easily contacted about such research, and that there is appropriate oversight into rare cancers. This is again a progressive move, as the duty to promote research will write into law that the Health Secretary, whomever that is at the specific time, must take a proactive approach to maintain and promote rare cancer research. It embeds a duty into the Government's job description to make sure that ease of contact is properly facilitated and that there is appropriate oversight. The bill is not overextending when it says that strategic coordination is the key here. The appointment of a National Specialty League for Rare Cancers will put a champion into law who can cut through any silos that currently exist or start to develop as the effect of the bill takes hold. Clause 3 of the bill is a very critical part of this framework, as it aids in building a robust evidential basis for clinical trials by making a bespoke register for those with a rare cancer. The NHS sharing information from the National Disease Registration Service with the NIHR be part of research registry so that patients can be identified and contacted will improve an issue I've heard come up several times speaking to organisations in this space, that there are not enough people available for clinical trials for rare cancers. Correspondingly, as has been mentioned by other members, there is clearly a substantial barrier at the patient end, as Cancer 52 found that 82% of those with a rare cancer had not been offered a clinical trial. This evidences the clear case for change this bill puts forward. With rapid advances in cancer treatment, there is a massive opportunity to take steps forward in increasing survivability after diagnosis. For all these new treatments to be effective, there need to be corresponding clinical trials. Currently, connecting those with a rare cancer to clinical research involves an amount of luck, that the information about the trial will make its way to the patient and that they'll be aware of a clinical trial. Organising this register so that clinical trials can get in touch with patients will simplify and improve the efficiency and efficacy of this system, saving time and increasing the chances of successful trials. I give this bill my full support. Thank you, Madam Deputy.